Hello, welcome to this session. In this session, I am going to discuss about the male reproductive system. So, in reproductive system, we study the female reproductive system separately and male reproductive system separately. So, we will start with male reproductive system. So, as far as reproduction is concerned, this is very important. It's an important part of human life, as the offspring, that the children has to be produced for the future generations. Okay, so as far as reproduction is concerned, anatomically and physiologically, there are many things, facts to be considered, and many facts have to be understood in order to know the difference between normal and abnormal. Okay, so primary sex organ for reproduction in male is testis. We call it as the male gonad. Okay, whereas in female it is ovary. We call it as female gonad. Okay, so these testes, they produce sperm cells. Ovaries, they produce ovum cell. So that's what we call it as gametes. Okay, apart from this, to nourish, to develop these cells, and also to show the secondary sexual characteristic features in the body, the male sex hormone, that is the androgen, which we call it as the testosterone, is produced, and for females the estrogen and progesterones are produced. This is estrogen and progesterone are called as female sex hormones. Okay, apart from this, there are other glands, other organs, okay, that is mainly responsible for reproduction. We call that as accessory reproductive organ, that is the tubes that is conducting, that is taking the sperm cells, the glands that is nourishing the sperm cells and also producing the testosterone hormone, and the external genitalia, which we call it as a copulatory organ, which we use for insemination. Okay, so coming to the male reproductive system, you have two testes, the right testis and the left testis. This testis in the intrauterine life, it is exactly formed below the kidney. Okay, it is exactly formed below the kidney, and these testes have blood supply from the testicular artery, which is a paired artery. Okay, that is originating from the abdominal aorta. Okay, so this, since the testis is formed in the area below the kidney, it keeps migrating. So you have to understand how this migration is taking place. Then only you will be able to understand many type of pathologies based on this. Okay, in the intrauterine life, the testis is developed in this region, and there is a ligament that is attached to the testis, a band. Okay, this name of this band is called as a gubernaculum, that keeps pulling the testis in this direction. Okay, it keeps pulling the testis in this direction. And if you see the artery, the testicular artery, if you see the testicular artery, I will hide all these things. Okay, this is the testicular artery. Okay, you can see how long it is. Okay, so this is the area the testis is formed, and the testis keeps traveling during the embryonic intrauterine life. Okay, before few days or after a couple of days after delivery, this testis comes and passes through this ring. This ring is called as the deep inguinal ring. I'm going to show you the ring. Okay, so this is the deep inguinal ring. This is the deep inguinal ring. and you have the superficial inguinal ring here in this place. Okay, so to understand this, let me remove the ring. This is the anterior superior iliac spine, and this is a pubic tubercle. You have the inguinal ligament attached. Okay, on this inguinal ligament you have two ring shaped structure here. You have two ring shaped structure. This is the superficial inguinal ring. This is a superficial inguinal ring, and this is the internal oblique abdominal muscle. They form a tubular structure, and then the deep inguinal ring is present here. Okay, the deep inguinal ring is present here. Okay, so if you see clearly in this place, the testis travels through this place, and then there is a tubular structure, we call it the inguinal canal, and this is a deep inguinal ring, and this is a superficial inguinal ring. So near the time of birth, this testis travels through this tube and comes and lands in the scrotal sac. Okay, so this kind of migration will take place normally. If after the birth, in newborn baby, you have to assess whether the testis is present in the scrotum or not. If the testis is absent, then you have to refer the baby for pediatric surgery department to scan where is the location, so that we have to pull the testis and place it here. Otherwise, the person can develop choriocarcinoma, cancer. Okay, so that is the importance of this inguinal ring. And moreover, along with this, the omentum also sometimes come in this tube and comes and land in this scrotal sac. We call that as inguinal hernia. There are two types, that is a direct inguinal and the indirect inguinal hernia. Okay, so I will show you a picture. So what you see here is, when the intestinal omentum comes through the deep inguinal ring and then comes through the inguinal canal and exit out through the superficial inguinal ring, and the bulge comes to scrotal sac, we call it as indirect inguinal hernia. Okay, so whereas if there is weakness, this is, you can see the difference between direct and indirect. Direct is the hernia that is taking place directly through the superficial inguinal ring. Okay, that is taking place directly through this superficial inguinal ring, that is direct inguinal hernia. Whereas indirect inguinal hernia is, it passes through the deep inguinal ring and also through the superficial inguinal ring, that is indirect inguinal hernia. So whenever a patient complains of bulge in the scrotum, you have to examine whether the inguinal hernia is direct or indirect type. Okay, direct or indirect type. So now the testis come and landed. Okay, so when the testis is coming to the scrotal sac, it pulls around 8 layers of membrane. So whenever you want to approach the testis with your hand, you need to cross around 8 layers of membranes from the skin. Okay, likewise in the abdomen, anti-abdominal wall also, there are 8 layers of structures. Okay, so we will see that what are the layers. So now if you look at the male reproductive system, you have let me show you those layers that is present in order to approach the testis. So I have removed the skin, and after the skin, the next layer here is, after the skin, the next layer is, is the dartus fascia. Okay, so the whole scrotum is made up of a special type of smooth muscle called as dartus muscle. This is a dartus muscle. Okay, the reason for keeping the testis outside the body is in the body temperature. In the body temperature, the spermatogenesis, that is formation of sperm cells, cannot take place. Okay, so whereas that is the reason the testis is kept outside, but the blood is coming through the testicular artery. Okay, so when you have to remove the skin, you have a layer of muscle called as dartus muscle. Okay, that is this dartus muscle. The property of this muscle is whenever the body's temperature is more, then what happens, this muscle will relax and pull the testis away from the body. When the body temperature is less than the external atmosphere, this dartus muscle will squeeze and push the testis towards the body. And during the time of ejaculation also, this dartus muscle contraction will squeeze the testis and push the sperm cells towards the duct. Okay, so that duct system we will see. Now to approach, we have to know what are the different types of layers that is present, okay, on this scrotal sac. So this is one layer, dartus fascia, and next layer is the external spermatic fascia. Okay, this is, then the next layer is cremasteric muscle. This cremasteric muscle extends all the way from the inguinal canal. Okay, it is extending all the way from the inguinal canal. The cremasteric muscle is extending all the way from the inguinal canal. Okay, next is the internal spermatic fascia. The internal spermatic fascia. Next you have the outermost layer of the testis, that is called as a tunica vaginalis. Okay, then you have the actual testes. Okay, so whenever you want to do any surgery, repair in the testes, you have to cross these many layers. Okay, so this testis is connected to a comma shaped structure which is having a lot of tubes. It's called as the epididymis. This structure is called as epididymis. And now we have to cut the testis and see what are all the cross section of the testis. So the outermost layer is the tunica vaginalis. Then you approach the testis. The outermost after this layer, the outermost testis layer is called as tunica albuginea. Okay, now I cut the cross section of the testis. In the when you cut the testis, you have these sections. Okay, we call it as the tunica vasculosa. This vasculosa forms different septum for the testes, inside the testis. Okay, so in each testis there are lobules. These lobules contains the seminiferous tubules. Okay, and these interstitial cells. The interstitial cells in this area is called as the Leydig cells, which secretes testosterone, male sex hormone, whereas the seminiferous tubules, these are producing the sperm cells. Okay, that is exocrine function, whereas secretion of testosterone by the interstitial cell is called as the endocrine function. So these seminiferous tubules are connected to the tubular structure. This is called as a rete testis. This rete testis is in fact connected to the efferent ductules, and through which the sperm cells travels. Okay, so when it comes to this epididymis, they are the coiled tubular structures. They collect all these sperm cells and keeps them traveling through this vas deferens. This tubular structure is called as the ductus deferens, or also called as the vas deferens. Okay, so for male sterilization, if the male don't want a child, we have to do vasectomy. That is, you have to open the seminal vesicle and you have to cut this tube, so that you are blocking the route where the sperm cells are going. Okay, you are blocking the route where the sperm cells are going. So this is how, this vas deferens plus this testicular artery, okay, vas deferens, this testicular artery, and the multiple number of veins. See, these are all the multiple number of veins. Okay, this multiple number of vein is called as the pampiniform plexus. Finally they form the testicular vein. And the cremasteric muscle around are collectively called as the spermatic cord. Okay, all these structures are collectively called as spermatic cord, and there are rich amount of lymphatic circulation around the testis. Okay, you know what, the sperm cells lives for 48 hours. So what will happen after 48 hours? So these sperm cells will die. Once these sperm cells die, the lymphatic channels that is present around the testes, okay, the lymphatic channels that is present around the testes will absorb, okay, they are the testicular lymph vessels, will absorb the dead sperm cells and push them towards the cisterna chyli. Okay, so they are like a drainage system. So in case if this lymphatic vessel is blocked, what happens? That lead to a condition called as the hydrocele. Hydrocele is a collection of fluid. Around the testes. Okay, so this is the hydrocele. You can see there is more amount of fluid collection around the testes. The testicular tissue is not damaged, but this interstitial, the extracellular fluid will be collected here and it will bulge. This is a normal scrotal sac, and this is scrotal sac with hydrocele. You may ask, sir, once the fluid is collected, we can inject a needle and take the fluid. Then again after 2 days, still the fluid collection will be present and it will be secreting, and again it will be bulging. So every 2 days you cannot be putting a needle and you cannot be taking the fluid out. So for that, what you have to do is you have to do a surgery called as hydrocele repair. So in this, what we do is we just open this, make an incision, turn the sac, revert the sac and suture it. So what happens? This fluid will be absorbed by the lymphatic channels present in the skin. So it is not going to affect the spermatogenesis. This is what we do in the hydrocele operation. Repair. So the scrotal sac has so many importance. Okay, so now let's go to the next topic. So the duct system, which has the epididymis, vas deferens, ejaculated duct and urethra, and also accessory male gland, that is a semivesicle, prostate, bulbourethral gland. We will see all these things. Okay, so let's start with the tube of the male reproductive system, that is the vas deferens. Okay, as I told you, this vas deferens, it starts in the epididymis and go all the way up to the superficial inguinal ring. Okay, so here you can see this is the superficial inguinal ring. Okay, this is the superficial inguinal ring. This is the superficial inguinal ring. Through this ring, this vas deferens passes, and in the middle of the inguinal ligament you have the deep inguinal ring. Okay, so this inguinal canal is formed by the internal oblique abdominal muscle, and here you have this deep inguinal ring. Okay, so this vas deferens passes through this superficial inguinal ring and the deep inguinal ring, and then descends down. It is descending down. So once it descends down, you can see it is just going in the posterior aspect of the urinary bladder. Okay, now I will remove this bone for your clear view. Okay, so it is going to the posterior aspect of the urinary bladder. Okay, so this vas deferens will bulge before it enters into the prostate gland. This bulge is called as the ampulla of ductus deferens. The sperm cells are immotile. If you look at the parts of the sperm cell, there is a head, body, and tail. Tail doesn't move. After the sperm cell comes to this storage sac that's called as seminal vesicle, then by the nourishment of the prostate gland, then the sperm cells will start to move. So immotile sperm cells, we call it as azoospermia. Immotile sperm cells, we call it as azoospermia. Okay, now when the sperm cell comes to the ampulla of ductus deferens, it goes and stores. Now I will remove the section of the prostate gland. It goes and stores in this pouch that's called as a seminal vesicle. Okay, this is around 2.5 ml capacity pouch, the seminal vesicle. Okay, now the sperm cell comes here. Okay, then the prostate fluid will come through this tube to the seminal vesicle, and this prostate gland secretion is rich in fructose, that is nourishing the sperm cells. Okay, so once the sperm cell is nourished, and during the time of ejaculation, what happens, before ejaculation, the urethra will start to prepare. How it prepares? Because urine is a toxic substance. This toxic substance will be washed before ejaculation by this secretion. Okay, what is this? There is a small peanut shaped gland that's called as the Cowper's gland, also called as the bulbourethral gland. Okay, now I am going to show you how this bulbourethral gland is collected. Okay, you see, this is the connection of this bulbourethral gland to this urethra. So before ejaculations, this bulbourethral gland will secrete and clear the toxic substance in the urethra, and it is clearing the toxic substance in the urethra. Okay, and then washing all the excess salt, unnecessary salt in this tract. So during the time of ejaculation, what happens, this prostatic urethra will close, and there is some sympathetic nervous system mechanism that squeezes the seminal vesicle, and that time the ejaculatory duct opens in the right side as well as in the left side. This ejaculatory duct will push the semen, the mixture of sperm cell and the prostate fluid, we call it as semen. This semen comes through the urethra and exits the body out. Okay, so this is what is taking place during the time of ejaculation. Okay, so this is the duct system, this is the tubular system that is present in the male human body. Okay, so now as I told you, one more applied anatomy regarding these veins. As I told you, this my question is simple. The scrotum is placed outside the body because the scrotum cannot have the body temperature. I mean, scrotal cannot produce sperm cells in the body temperature, but the blood is coming through the testicular artery, carries the body temperature blood. Then how this theory will support? So what happens on the way, these blood vessels are coiled by this bunch of vessels that's called as a testicular vein. Okay, which is a branch of, this is the testicular vein, this is the testicular vein. Okay, and you see, this is the testicular vein that's going to inferior vena cava, but and in the spermatic cord it is multiplying into multiple number of branches. These branches is called as the pampiniform plexus. These branches will cool the testicular artery blood. Okay, so in case some patients may have block of this testicular vein, so that time it leads to a condition called varicocele. It leads to a condition called as varicocele. What happens? There will be bulging of all these small veins. Okay, there will be bulging of all these small veins. You can see this is a painful condition in the male. So when you catch the upper end of the scrotum, it looks like a worm like appearance. Okay, you can see multiple worm like this is a normal vein, this is the bulged vein, which we call it as varicocele. So this patient needs surgical fixation, surgical repair of these vessels. Okay, so this is the varicocele. You have to understand that's a condition, painful condition for male in the reproductive. It doesn't affect the reproduction, but still it is a highly painful condition. Okay, so coming to this tubular structure, you have the seminal vesicle. I have shown you. You have this prostate gland and this ejaculatory duct. Now let us go to the other part. As I told you, the scrotum is a sac that is made up of this dartus muscle, okay, that contains paired testes. It has minus 3 degree lower than the core body temperature. Normal body temperature is 37. So the scrotal temperature should be around 34. Okay, so then only the spermatogenesis can take place. Okay, so there are two types of muscle. One is the dartus muscle and the cremasteric muscle. This cremasteric muscle is present in all the place of the spermatic cord. Okay, so this is also helping to propel this sperm cells towards the ejaculatory duct. Okay, next, the testis, as I told you, the outermost layer is the tunica vaginalis and the inner fibrous capsule is the tunica albuginea. So these testes have around 250 to 300 lobules. These are all the lobules. Okay, each contain 1 to 4 seminiferous tubules. In this seminiferous tubules only the sperm cells are produced. Okay, these seminiferous tubules are connected to this concentration of the tubes that's called as retate testis, which is in fact connected to the efferent ductules. This comma-shaped structure is called as epididymis. They are nothing but the tubular structure that is connected to the vas deferens here. This vas deferens is coiled in the scrotal sac and it is going as a long tube towards the ejaculatory duct. Okay, so the sperm cells keeps moving through this epididymis and the vas deferens, and then finally it will reach this sperm. So if you look at the microscopic structure of the testes, you have the seminiferous tubules and the interstitial cells. Okay, so these are the interstitial cells. Okay, so it's also called as the Leydig cells. Okay, so which produces the testosterone. Testosterone is a male sex hormone that gives masculine appearance, like change in voice, rough skin, then facial hairs. Okay, all these are done by this male testosterone hormone. Okay, then when as far as blood supply is concerned, you know that the testis is supplied by the testicular artery and the testicular vein. The pampiniform plexus is nothing but branches of the testicular veins. Okay, the spermatic cord is nothing but a collection of these nerve fibers, blood vessels, lymphatics and the cremasteric muscle. Okay, coming to the copulatory organ, the penis, it has the root, body and the glands. Okay, so the prepuce or the foreskin is cut off loose skin covering the glands, and circumcision is surgical removal of the foreskin. Okay, so now I will show you these different parts of the penis. You know, if you see here, this skin, okay, this skin is covering this copulatory organ, that is the penis. And you know, sometimes the hole is not present in the skin. Okay, imperforate skin might be there, so we have to do surgical repair in the newborn baby to remove this. So what happens, the covering of the skin around the glans penis will lead to infection of accumulation of infection. So that's why in certain culture they remove the foreskin in the childhood age. Okay, so when it comes to the penile shaft, it is covered by the subcutaneous tissue. Okay, there are two bodies. Okay, this tip is called as a glans penis, which is compared to clitoris in the female, This is having lots of nerve ending, that is a pudendal nerve ending, and that is very sensitive structure. If you remove the fascia of the penile shaft, you have the tunica albuginea of the corpora cavernosum. This is nothing but a cylindrical body. Okay, there is right corpora cavernosum. Okay, this is extending in the inferior pubic ramus. This corpora cavernosum is expanding in the inferior pubic ramus, as well as there is left corpora cavernosum. There is a left corpora cavernosum. So this is the right and the left corpora cavernosum that is extending in the inferior. So this is a sort of rich vascular bed. Okay, so whenever the erection takes place, this vascular bed is filled with the blood, and thereby the erection is taking place. Okay, so this corpora cavernosum is divided by one it is divided by the septum of the penis. Okay, this septum is between the two cylindrical body. Okay, underneath you have one corpora spongiosum. So this is the corpora spongiosum, which is also covered by the tunica albuginea. Okay, this is the corpora spongiosum. This corpora spongiosum, it opens in the glans penis, and there is presence of this urethra. So the male urethra is running through this corpora spongiosum. So there are three cylindrical body. One is the right and the left corpora cavernosum, and this corpora spongiosum is present underneath, through which this male urethra is running. Okay, the penile urethra is running. So this is also a vascular tissue. You can see there are lots of porous vascular structure here. Okay, so whenever erection takes place, this area will be filled with blood, and once the is finished, this blood drains through the pelvic veins, and then the erection will reduce. Okay, so this is how the penile shaft is made up of. Even for female also, this corpora spongiosum and cavernosum is modified in such a way that this is very short. I will show you in the female anatomy. Okay, so this is a copulatory organ. This is a cross section. You have this corpora cavernosum and spongiosum, and the urethra is running in the center of the spongiosum, and there is a deep arteries that will be filling the corpus cavernosum during the time of erection. And the superficial aspect, you have the penile veins, where after ejaculation, the blood present in this corpora cavernosum will drain into these veins. Okay, so this is how the shaft of the penis is made. Now coming, as I told you, the duct system, that is the tubular structures that is connected between the scrotum and to the how it is reaching the prostate gland, and then connected to the urethra, penile urethra. Okay, so the epididymis, which is a comma-shaped structure having the head and tail, body and the tail. So during ejaculation, the epididymis contracts and expels sperm into the ductus deferens. Okay, that is the vas deferens tube. This tube passes through the inguinal canal, expand to form the ampulla at the joint, the duct of the seminal vesicle, to form the ejaculatory duct. Okay, so vasectomy is cutting this vas deferens so that the sperm cells will not cross the barrier. Okay, so urethra, I have told you, in the urinary system we have the prostatic urethra, membranous urethra, and the penile urethra. Okay, so this prostate gland is a gland that has to secrete and give nourishment for the sperm cells. So when you look at the prostate gland in the male, this prostate gland is present only in the male, okay, and it is attached by this puboprostatic ligament and also this detrusor apron muscle, okay. So here if you see, this is a boggy gland, this is a boggy gland, this is a boggy shaped gland, and the digestive system is opening here, the digestive system is opening in the anterior aspect. So when you want to see whether the prostate gland is enlarged, you have to insert the finger in the rectum and palpate this prostate gland. If the gland is very hard and hypertrophied, this is how the prostate gland is examined, okay. This gland will swell and you can feel the swelling in the rectum, okay. So this is how the prostate gland is examined. This is how the prostate gland is examined. So after 50 years in male, this enlargement of this prostate gland is very common, okay. That leads to narrowing of this prostatic urethra and leading to obstruction. So patient will come to you that they they have the urge to urinate, but when they go for a micturate, they are getting only drops of urine, okay. So that time if you check the perirectum examination, you will see a enlarged prostate gland, or you can do ultrasound to see the size of the prostate gland. So in that case, what happened in the emergency situation, we do suprapubic catheterization. What is that? So above the pubis, this is the os pubis joint, this is the os pubis joint, the bladder will be enlarged like this, okay. So we just puncture the skin and puncture the needle into the bladder and insert a tube. So through the tube, the urine will be draining in the anterior aspect. So this is called as suprapubic catheterization, okay, to save the life. Later, after the prostate prostate tone is reduced, then you can go for small catheter, and maybe if the prostate tone is not reducing, you can go for transurethral resection of prostate, okay. So that's a procedure in urology department. They just remove this prostate in the form of chips and they will make the lumen big, okay. So this is the prostatic urethra. Then the membranous urethra is present in the urogenital diaphragm. If you look at the muscles here, this is the pelvic muscles, these are the pelvic muscles, okay, these are the pelvic muscles. These are the pelvic muscles. These are the pelvic muscles, okay. So you see here, this is the levator ani and the puboanalis and pubococcygeus muscles. These are the pelvic muscles, and this is the external urethral sphincter. You can see this is the external urethral sphincter. So internal urethral sphincter I have shown in the bladder when I am teaching the urinary system. This will be contracting and holding the urine. This will be contracting and holding the urine, okay. So that part of the urethra is called as the membranous urethra. Then when it enters the penis, it is called as a penile urethra. You have to note that the bulbourethral gland is present, is opening, it is present in the urogenital diaphragm and it is opening into the penile urethra. I told you the function of the Scoupus gland, okay. So let's go to the next slide. Then as I told you, there are paired seminal vesicle, okay, which produce yellowish viscous alkaline seminal fluid, which is rich in fructose, ascorbic acid, coagulating enzymes, and prostaglandins, 70% of the volume of the semen, okay. So duct of the seminal gland joins the ductus deferens to form the ejaculatory duct. So this is forming this is a seminal, this ampulla of vas deferens, this is seminal vesicle, and it is joining the ejaculatory duct here, and this is called as the prostatic urethra, okay. So it is the prostatic urethra. Then the prostate encircles part of the urethra inferior to the bladder, and it secretes milky, slightly acidic fluid, citrate, and prostate specific antigen. If the PSA level is more in the blood, then it is showing that it is having some hypertrophy or any cancerous condition. Okay, so the prostate specific antigen is checked, and if the level is more, then we may go for further investigations. Okay, then the bulbourethral glands is a Cowper's gland, which is peanut shaped gland, lubricates the gland's finish and neutralizes the acidic urine in the urethra. Okay, semen. Semen is a mixture of sperm cells and the glandular secretions. Okay, the prostaglandins are present in the semen, decreases the viscosity of mucus in the cervix. Okay, on the female, then stimulates reverse peristalsis in the uterus. The hormone relaxin enhances sperm motility, and the fructose will produce ATP for the sperm cells. Okay, then the ingredients to suppress the immune response in the female reproductive tract, it is alkaline, whereas the vaginal mucosa is acidic in female, whereas the semen is around 8. Okay, which will neutralize the acid in the female vaginal cavity. Okay, it has a antibiotic chemical to destroy the bacteria. Then clotting factors coagulate semen just after ejaculation, and then fibrinolysin liquefies it. Only 2 to 5 ml of semen are ejaculated, containing 20 to 150 million sperm cells per ml. Okay, so oligospermia is reduced sperm cell count. Okay, azoospermia means it is immotile sperm cell count. Okay, this is the parts of the sperm. It has a head, body, and the tail. Okay, so the head, there is nucleus and the acrosomes. So I will show you one video in the female about fertilization, so you will be able to understand the action of sperm there. Okay, then major regions are head, which is having the genetic materials in the nucleus. Okay, and acrosome is having the hydrolytic enzymes that enable the sperm to penetrate an egg. So it has tail, will help in the locomotion, that is movement of the sperm cells. Okay, so spermatogenesis is formation of sperm cells by mitosis and meiosis and spermogenesis. 3 type of method the sperm cells are produced. Okay, so the spermatogonia in mitosis, it changes into spermatocytes. Spermatocytes undergoes a process of meiosis 1 and meiosis 2 and changes into spermatids. This spermatids is maturing and changing by the process of spermatogenesis. It is changing into sperm. So all these are happening in the seminiferous tubules. Okay, so the seminiferous tubules, as I told you, it's a tight junction. Divides the wall into 2 compartments, basal compartment and adluminal compartment. Okay, spermatogonia and the primary spermocytes are present in the basal compartment, and the adluminal compartment will multiply and allow the mitotic activities of the cells. Okay, so this is how these sperm cells are produced. This is spermatogonium. Then it is maturing into primary spermatocyte, and then secondary spermatocyte, early spermatids, late spermatid, and finally it is developing the tail, and the tail doesn't move in this testis. Okay, the tail movement starts only in the ejaculatory duct or the seminal vesicle. Okay, next, the tight junction forms a blood-testis barrier, prevents sperm antigens from escaping into the blood, where they would activate the immune system. Because sperms are not formed until puberty, they are absent during immune system development and would not be recognized as a self. Okay, so after puberty only the sperm cell production will be present. So what is the Sertoli cells? These the seminiferous tubules are made up of Sertoli cells. Okay, whereas the interstitial cells are also called as Leydig cells. Okay, so the seminiferous tubule, which is made up of Sertoli cells, it provides the blood-testis barrier to chemicals in plasma. So it nourishes developing sperm, secretes luminal fluid including androgen binding proteins, Then secretes inhibin, which inhibits follicle stimulating hormone, the pituitary. Secretes parascreen agents that influence the functions of Leydig cells. Secretes Mullerian inhibiting substance during the embryonic development, causing primordial female duct to regress. Okay. Then hormonal regulation of male reproductive functions. Okay, so in this we have to know that the hormone regulation is taking place from the hypothalamus, which releases gonadotropin releasing hormone. That gonadotropin releasing hormone comes to anterior pituitary to and make them to secrete follicle stimulating hormone and luteinizing hormone. So follicle stimulating hormone causes cystinocytes, that is Sertoli cells, to release the androgen binding protein, which makes spermatogenic cells receptive to testosterone. So the follicle stimulating hormone level is also important, and the testosterone hormonal level is also important for the male to have a proper sperm development. Okay, so luteinizing hormone is triggering the this interstitial cells, okay, to and make them to secrete testosterone. Testosterone is the final trigger for spermatogenesis. No testosterone, no masculine character, and no sperm cell production. So the feedback inhibition on the hypothalamus and pituitary results from rising level of testosterone, inhibin release when sperm cell count is high. These are produced by these Sertoli cells, that is called as cystinocytes. Okay, so as I told you, the hormone regulation starts from hypothalamus to anterior pituitary to testes, where there is presence of interstitial and the seminiferous tubules. Okay, mechanism and effect of testosterone activity. It activates the sperm cell formation. Spermatogenesis means sperm cell formation. Targets accessory organs. Deficiency leads to atrophy of the testes. Testosterone deficiency leads to atrophy of the testes. Has multiple anabolic effects throughout the body. It is the basis for sex drive in males. Okay, so if the testosterone level is less, then that sex drive level also decreases. Okay, then male secondary sex characters are mainly done by this testosterone, like appearance of pubic and axillary and facial hairs, enhanced growth of the chest and deepening of the voice, skin thickness and becomes oily, bone growth and increase in bone density, skeletal muscle increase in size and mass. These are all the male sexual characteristics that is done by the testosterone hormone. If the testosterone hormone level is less, the atrophy of the testis is taking place, as well as there is reduction of the secondary sexual characteristics. So these are all the things that you have to know about the male reproductive system, and we will start with the female reproductive system in the next session. Thank you.